announcements and declarations, and afterwards we're ready, of course, to take questions. Professor Stefan.
The Ebola emergency meeting has today advised the Director General to declare a public health emergency of international concern, a FIC. What does that mean? This is still a regional emergency and by no way a global threat. And why this change of opinion? Despite the collective effort and particularly a tremendous support by both the government of the Democratic Republic of Congo and the commitment of the people fighting in the field against Ebola, also despite significant improvement in many places in a tremendously complex situation, now, first, there is concern about spread of Ebola from Goma, the getaway, even though so far no cases were newly infected in this city. Two, there is disappointment that there has been a recurrence of intense transmission in Beni, so that the geographical expansion is now some 500 kilometers. Four, the fight is ongoing for a full year now. And lastly, the assassination of 2 Ebola workers demonstrates the continued risk to responders due to security situation.
As a result of this concern for potential further spread, the committee recommended that I declare the outbreak a public health emergency of international concern, FIC, and I have accepted that advice. Our risk assessment remains that the risk of spread in DRC and the region remains very high, and the risk of spread outside the region remains low. I have also accepted the committee's recommendations for DRC, its neighbors, and all countries. I emphasize that WHO does not recommend any restrictions on travel or trade, which rather than stopping Ebola can actually hamper the fight. Closing borders could have disastrous consequences for the lives and livelihoods of the people who cross the border every day for trade, education, or to visit relatives. Such restrictions force people to use informal and unmonitored border crossings, increasing the potential for the spread of disease.